Well, let's go back to the bedside. And if I'm a physician or a nurse or anyone that's at the bedside of our facilities we support, what should their experience look like when they tap the button or they give us the phone call? What should that experience look like for them?
So I think it should look like how it looks when you work with another colleague at the bedside.
That's a great way to say it.
Yeah. Like we're really trying to replicate that, but virtual. So if I'm working at a large facility, there's usually more than one physician on at a time, right? And we're seeing different patients. But we may be discussing cases, you know, there may even be difficult cases where I might bring my partner in for a second opinion type thing.
Yeah.
And then also you have consultants, right? So you have someone, kind of a phone a friend, right?
Yeah.
And so we're trying to replicate that and having them have someone that they can reach out to.
And that's a great way to put it. How do you ensure that, like, our clinical decisions that we're helping support them if they're asking for advice on something is truly at the best interest of the patient, since we can't have our hands on them? How do we make sure that we're helping guide them in the best way possible?
I think it comes back to those reps and sets that we talked about,
Absolutely.
right? I think that we see a lot of bad stuff, right? We see a lot of really critical patients. And I think the more that you do that, you really get good at walking someone through that on the other side in a way that's calm. You know, I was talking to one of the people who came and took our airway course last week.
Yeah.
And she said, like, how do you guys stay so calm?
Yes.
When things are crazy, right?
And you're seeing all of the chaos on the screen. Yeah.
Yeah. And I think, you know, I would say when I first started doing this kind of work, when things got crazy, probably my face got bigger and bigger in there.
Being closer.
Trying to get in there to help them. But I think then, you know, like you get good at helping them to know what is the next thing that they need to work on. Or sometimes we're saying things like, have you ever thought about trying this? You know, if it's not a critical time, but just discussing the case in a way that's either educational or really just collegial, right? Yeah. You know, like in medicine, there's not always just one way to do the same thing or to get the same outcome, to be honest. And so sometimes it's, you know, should we use this medication or this medication? Which one is probably best for this patient? Or, you know, you may really like to use this class of blood pressure medicines. I may like to use this one. And that's okay. And I think our teams are really flexible in that because, you know, it's more important that they're using what they are comfortable with as long as it's safe and the right tool.
Yes.
Can I tell another story?
Yes, I'd love another story.
Okay, you can put this wherever you want. So I was traveling, this is several years ago, but I was traveling to a really, really small town in the United States. And it was one of these counties where they had one physician and one nurse practitioner. That was the entirety of their staff, besides their nursing staff, of course, right?
Yes.
And so we're talking to them about our services and kind of, you know, just having that discussion. Yeah. And a lot of times when you go to that small, like everybody's there, right? Like all the nurses are there. Yes. The paramedic is there. The board is there, you know, and like the banker's there. Like everybody's there.
Everybody's at the table.
Everybody's in the room. And so we're talking about it. And the paramedic in the room said, you know, I think this is all great for other people, right? But our physician always sees everything in black and white and always knows exactly what to do. And so, like, I don't know why we would ever need this. Yeah. And he's always here, right? Like, he's always on. So he's always here to help us. And so I don't think we need this type thing. And I was like, oh, that's awesome. You know, like, great. And
but are you sure?
Yeah. And so we just kind of went on talking. And then the physician actually stood up and turned to that paramedic and said, you know, I'm so glad that you do think that I always know what to do.
Wow.
And I want you to.
Yes.
But sometimes I don't in here. And I need to reach out to someone for a second opinion.
Wow.
And the whole room changed. Because I think him being vulnerable in that spot, because nobody knows everything about everything.
No.
In any situation, right? Like in any profession, right? And so we should always be learning. We should always be changing. And immediately they saw the value, right?
Wow.
Yeah. And he said, I can't go on vacation. I can't go to my kid's ball game.
Yeah.
Right? Like, this could change my life.
Wow.
Yeah. And so, like, those are the moments, I think, for me, that I just think, like, that's going to keep that physician in that town. So it's retention, right? It's about recruitment and retention and keeping rural hospitals open.
Yes.
That's what it's about.
End of story.
Yeah.
Well, that's cool. That I feel like we've talked a lot about skepticism on the clinical side, but it's fun to hear. Not that it's fun, but it was a cool story to hear it from the other side. Because I feel like that's, and I was going to ask you that if you had another example from the clinical perspective of their skepticism, and then finally getting to see how we can support them in real life and that difference that it makes. But fun to hear it from the admin side of things too, being like, no, my team's great. We got this.
Yep.
That's amazing.
Yeah.
Do you want to say another story about a clinical side? I feel like you have tons of skepticism that you've overcome.
So in my bedside practice, even though it's a large facility, right, we have the cameras there. And I have used them. We use them very commonly in any sick patient that we have, any critical patient that we see. So anytime we're doing a code, anytime we're doing an airway, anytime we're using, having an MI, things like that, we are utilizing the cameras, even in our trauma center, right? Okay. And so I had an extremely sick, one of the sickest patients I've ever cared for, ever. And I was at the head of the bed and having to intubate very quickly on this patient. And I had to put in a central line. I mean, I had a lot of things I needed to do to try to resuscitate this patient. Yeah. And I also needed to call a specialized surgeon. Okay. And so having that partner in there virtually in the room with me, so often I'm the person on the other side of the camera making those phone calls, right? Yes. But I was like, I can't leave. I
can't keep my hands off. Right? I got to keep them in.
Yeah. But I also can't wait to call the surgeon because I need them to get here, right? Yes. And so, I was able to say, here's what's going on. This is what's occurring. This is what I need. Can you do this for me? And to this day, I know that saved that patient's life, right? Wow. Because we were able to partner in order to take care of that just really sick patient.
Well, and how cool to see it from the other side. Yeah. Because you talk about it all the time, but really now you getting to experience it as well and supporting you.
Yeah. I think all of my physicians who work, it doesn't matter what service line, right? It can be our senior care services and the care that they bring to our long-term care centers. Yeah. It can be our pharmacists, our intensive care physicians. It doesn't matter. We're all huge believers in it because we see the difference that it makes. And it's, we're just all believers. And I think that drives engagement.
Yes, absolutely.
Right? And then, then when we practice at the bedside, it becomes just a natural part of the way that we practice there as well.
Very cool.